Snoring, that's more than an ugly noise. It can ruin a relationship. Dr. Hilary investigates ways of getting a better night's sleep.
Right, do you sleep soundly at night, or do you have to put up with a racket created by a partner who snores? If Anthea was here now, she could tell us a thing or two. But Dr. Hilary is here now with advice for Britain's 3.5 million snorers and those they have to live with. So tell us all, Hilary.
Well, many of us think that snoring's a bit of a joke. But for those of us who have to live with a noisy partner, as we've just heard, it can be a very real problem. However, with the numerous anti-snoring remedies available and newly developed laser surgery for the acute snorer, there's no need now to despair. Different remedies work for different snorers. And even the world's loudest snorer, Mel Switzer, who joins me today with his long-suffering wife, Julie, has found an answer to his problem. Good morning to both of you. Good morning. What does it feel like to be the world's loudest snorer?
Wonderful, because I sleep very well at night.
But not so for you, Julie.
Not so for me, no. I've got the advantage that I'm deaf in one ear, so I can muffle the sound by sleeping on my good ear.
Well, I suppose that's a bit of good news amongst all the bad. You reached a level of something like 92 decibels to get into the Guinness Book of Records. Now, that's been equated to the sound of a pneumatic drill or the sound of a dog barking. Can you give us a demonstration?
Well, I can try, you know.
Yes.
Something like that.
I can imagine that I mean, although snoring's always portrayed as humorous and funny, it's obviously not always humorous, especially for the snoree, the partner. How have you overcome it, Julie? Because you must have lost quite a bit of sleep yourself.
Well, there was a lot of prodding, pushing, turning, but sometimes that didn't even work with Mel. He's tried a lot of remedies, which haven't worked, but I've just put up with it because I realised he wasn't doing it on purpose. He couldn't help it at all.
But we have heard stories of neighbours who've attacked snorers. We've heard stories of divorce and marital disharmony as a result of snoring. I mean, the social side can be quite serious.
Yeah, I've heard of these vicious neighbours. Luckily, I haven't had any vicious ones, but I've had 8 neighbours in 11 years, whether they're trying to tell me something or not.
They've moved. They haven't said anything, they've just moved.
They haven't said anything, they just moved.
Charming. That's British for you, isn't it? OK, so, but snoring has a bad health side to it, doesn't it? Because we know that people who snore badly often tend to stop breathing in their sleep, something called sleep apnea.
That's correct.
Do you get that?
There is a serious side of it. I don't suffer from sleep apnea, fortunately, you know, but the small percentage that do, that is very serious, and they should go to their doctor immediately, you know.
It's associated with raised blood pressure, it's associated with
yeah.
strokes and heart attacks and all sorts of horrid things, but that only occurs when the snoring reaches a crescendo and then stops because there's complete blockage of the airway, of the air passages.
That's correct.
Okay.
Unfortunately, my snoring is attached to the good life, i.e. if I go out and have a few drinks at night, then my snoring, then I perform well. If I don't have drinks, then...
So alcohol certainly makes it worse for you, and as it does for most people. Any other factors make it worse? Do you smoke? You smoke?
Smoke, that's definitely. And a late meal at night is the final thing. Right. All 3 combinations will...
And something else that many people say to me in the surgery is that if they take a sleeping pill, that will make snoring worse, because anything that makes the sleep deeper relaxes the muscles at the back of the throat even more, will tend to make you snore. Yeah. Okay. What have you tried in the past that hasn't been so successful but is commonly used? We've got a number of devices here in front of us.
The first thing I dived out and bought, because somebody told me I snored, was a pillow that's supposed to stop you snoring.
Is that a herbal pillow?
A herbal pillow.
Herbal pillow.
It smells nice, but it don't stop you snoring.
What's this device that looks like a large watch?
Now, that is a wonderful device, because that stops you snoring, but it also keeps you awake all night. It gives you an electric shock every time you do snore.
So you're going to wake up one way or another, but it's you rather than your partner. And this is one of these old-fashioned devices,
the
presumably.
Device that stops you laying on your back.
You strap this to your back.
Strap it to your back.
Like that.
But then you turn on the other side.
So you can't sleep on your back like that, which would make it worse.
Unfortunately, I can snore leaning on a bar. So,
OK, now we've got 2 more devices here. What's this one? It looks like a gum shield.
That's a gum shield to make you get the air through you bite onto that, and it's to make you get the air through your nostrils. But unfortunately, my nostrils are sort of not very big up there.
They're narrow.
So,
all right. And this little one, this is the one, that little tiny one is the one that works for you?
When I first saw that, I nearly threw it away. And that one, believe it or not, well, the first time I tried it, the wife thought I'd died.
It was so quiet.
do work on me. It's a perfect little thing, and all it does is keeps the nostrils open.
Right, and these are available from chemists?
Oh, yeah.
Okay.
Yeah,
Now, Julie, you've been listening very patiently to all this. They do say that with every 3 men that snore, only 1 woman snores.
Yes.
Do you snore?
I didn't think I did, but Mel said I do if I drop off to sleep on the sofa, so obviously I'm more relaxed then.
And why do you think it is that women don't snore as much as men?
Probably they don't drink as much.
That could be a factor, could be a factor. They also say that the muscles, this sounds very sexist, they say that the muscles at the back of the throat in women are thicker and stronger, which keeps the air passages open, and the female sex hormone progesterone also relaxes the muscles. But there are many devices, of course, available for snorers, and for you the cheapest and easiest one works, so that's a sign of encouragement, really, to all those other snorers out there. Okay, thanks both very much for coming in and sharing your experiences with us.